Now we are going to discuss about next nephrotic syndrome, that is the Mpgn, right? So next is membranoproliferative glomerulonephritis, Mpgn, membranoproliferative glomerulonephritis. These are immune complex mediated disorder, right? So that is the number one thing we have to keep in mind. These are immune complex mediated disorder. In this immune complex mediated disorder, they are associated with hypocomplementemia. So they are associated with hypocomplementemia due to nephrotic factor antibodies, right? So these are having association with hypocomplementemia due to nephrotic factor antibodies, right? So these nephrotic factor antibodies, usually their main function is to stabilize C3 convertase and to activate the complement pathway. So that is why when this complement pathway is persistently activated, so they will be having persistent hypocomplementemia, right? So they will be having persistent hypocomplementemia. So that is the important thing which I wanted to tell you. So who are these nephrotic antibodies, right? So as I said, I started like this. What are the Mpgn? These are immune complex mediated disorder where you will find persistent hypocomplementemia due to the nephrotic factor antibodies. What are the nephrotic factor antibodies? There are three types of antibodies. One is called nephrotic factor of classical pathway. So nephrotic factor of the classical pathway, which is called as C4NEF. So nephrotic factor of the classical pathway, C4NEF. Second is nephrotic factor of alternative pathway, which is called as C3 nephrotic factor. And fourth is nephrotic factor of the terminal pathway. Third is nephrotic factor of the terminal pathway. Nephrotic factor of terminal pathway. So nephrotic factor of terminal pathway will be consisting of NFT. These antibodies are associated with hypocomplementemia seen in Mpgn, right? Now we will see types of Mpgn. Right? So there are three types of Mpgn. Mpgn 1, Mpgn 2 and Mpgn 3, right? So Mpgn 1, Mpgn type 2, Mpgn type 3, right? So these are three types of Mpgn which we are going to discuss one by one, right? So Mpgn 1, Mpgn 2, Mpgn 3. Out of these three, Mpgn 1 is the most common type of Mpgn, right? So Mpgn 1 is the most common type of Mpgn. So this is the most common type of Mpgn, right? In this Mpgn type 1, what we will notice that they are most commonly associated with activation of both the complement pathways, means classical as well as alternative. So here you will see in the pathology, it is having pathology of activation of both classical and alternative complement pathway. Right, so activation of both classical and alternative complement pathway. So that is the important point to notice here. Classical and alternative, both the complement pathway will be having activated in case of Mpgn 1, right? And in this, which nephrotic antibodies are involved? So that is another important MCQ which examiner can ask you, right? So in this case, nephrotic antibodies are C3, C4, NEF. So they are associated with C4 nephritic factor antibodies, right? So they are associated with C4 nephritic factor antibodies. So what are the associations of the type 1? So here we have to understand they are associated with autoimmune disorders like SLE. They are associated with infections like hepatitis B, hepatitis C, or HIV. They are also associated with cryoglobulinemia, right? So here we have to understand they are also associated with mixed cryoglobulinemia. So mixed cryoglobulinemia is associated with type 1 Mpgn, right? So these are some of the important MCQs. Mixed cryoglobulinemia is associated with Mpgn 1, and they are most commonly associated with which infection? Hepatitis C infection. So these are about type 1 Mpgn, right? So type 1 Mpgn, these are the important things which we have to understand. Type 2 Mpgn, here we have to focus one thing for future exam, that C4NEF, that nephritic antibody is C4NEF, which will stabilize C3 convertase, and that is why there will be hypocomplementemia, right? Complement pathway will be activated and they will be having hypocomplementemia. Mpgn type 2. Mpgn type 2 is second most common type, and in this you will find activation of, so immune complexes are formed due to activation of alternative complement pathway. So alternative complement pathway will be activated because of the due to presence of C3 nephritic factor. So these are older All India questions. C3 nephritic factor is associated with Mpgn type 2, right? So C3 nephritic factor is associated with Mpgn type 2. Because of this, whenever you will see in this complex, which immune complex you will notice on immunofluorescence microscopy, you will find C3 and properdin. Right? C3 and properdin, and there will be no immunoglobulin, right? And no immunoglobulin. So that is why the new name for Mpgn type 2 is also, there is another name for Mpgn type 2. This is also called as C3 glomerulopathy. So that point also we have to keep in mind. Mpgn 2 is also known as C3 glomerulopathy. Right? So they are also called as C3 glomerulopathy. So Mpgn type 2, remember, Mpgn type 2 is also known as C3 glomerulopathy, which examiner may ask. Why? Because there is no immunoglobulin, only C3 and properdin is accumulated in immune complexes, right? So type 2 is associated with C3 nephritic factor, and they are also strongly associated with partial lipodystrophy. Older All India question, associated with partial lipodystrophy. So they are associated with partial lipodystrophy. This was the older question which we have to keep in mind. So Mpgn type 2 is associated with partial lipodystrophy, right? Mpgn 3 is a very rare subtype. It's a rare subtype. So remember, it's a rare subtype, and it is associated with complement factor deficiency. And they will be having NFT, nephritic factor for the terminal pathway type of nephritic antibodies, right? So nephritic factor terminal pathway type of antibodies will be associated with Mpgn type 3, right? So now we have seen Mpgn type 1, type 2, type 3, right? What I want to tell you, on microscopic examination, they will be having, all three will be having same type of light microscopic finding. So all three, Mpgn 1, 2 and 3, all will be having same type of light microscopic picture. So that is very important to understand. Light microscopy will be same for all of them. And what is the light microscopic finding? Light microscopic finding will be hypercellularity, right? So they will be having hypercellularity, right? There will be a double contour appearance. Double contour appearance or double contour. What is double contour? It is basement membrane, basically because of the immune complex deposit, that basement membrane will be looking as if there are two layers, right? So just for example, I want to show you this one. Suppose this is the capillary, basement membrane, endothelial lining, right? So when immune complex deposit is here, right, suppose this is the immune complex deposit between the basement membrane. So when they are depositing between the basement membrane, then also we can see there is a double contour. So we are thinking like basement membrane is having two types, huh? There are two basement membrane. So this is called double contour, or it is also called as duplication of the basement membrane, or this is also known as duplication of the basement membrane. So double contour, duplication of the basement membrane, or tram track appearance. So this is the another important feature which examiner says, tram track appearance. Tram track appearance, right? So double contour, duplication of the basement membrane, tram track appearance. Sometimes it feels as if it has been splitted into two parts because of immune complex. So it is also called as splitting of the basement membrane. Double contour, duplication, tram track, splitting of the basement membrane, all these things are used for finding in case of Mpgn, right? So double contour, duplication, tram track appearance, splitting of basement membrane, these are the findings you will see, right? Sometime what happens, mesangial cells will be coming inside because of mesangial cell proliferation, and they will be having interposition here in between the basement membrane, and basement membrane will be getting formed along with this. So there will be basement membrane like this. So this is also the reason we will feel like there is one basement membrane layer and there is another basement membrane formation. So because of the mesangial cell interposition also there is a duplication. So you can see there is a duplication of the basement membrane, or you will notice that there are two tracks. This is one track and this is the another track because of the mesangial cell interposition. So that is why it is called as tram track appearance. So these are the various reasons for all these things, right? So that's the point we have to keep in mind. This will be seen in all of the following Mpgn 1, 2, 3, all will be having all these finding: double contour, duplication, tram track appearance, right? What is the difference? You will see on electron microscopy. On electron microscopy, when you are seeing Mpgn type 1, you will notice they are having subendothelial deposit. Subendothelial deposit, right? So subendothelial deposits will be seen in case of the Mpgn type 1. Mpgn type 2, which type of deposit will be seen? This was another all India question. Mpgn type 2, you will find intramembranous deposit. Intramembranous deposits will be seen in type 2, and in type 3 Mpgn, which is the rarest type, they will be having all types of deposits: intramembranous, subendothelial and subepithelial. So all types of deposits will be intramembranous deposits, subendothelial deposits, subepithelial deposit, right? Intramembranous, subendothelial, subepithelial, all type of deposits will be seen in type 3. So these are the electron microscopic view of Mpgn. These were the questions in All India 2016. Subendothelial deposits are seen in Mpgn type 2, right? Mpgn type 1, sorry. Mpgn type 1, subendothelial deposits will be seen. Mpgn type 2, intramembranous deposits will be seen. These were the older question in All India exam, right? Because this intramembranous deposit will be very thick, and that is why they are called as dense deposit disease. So this dense deposit disease, that is why they are also known as dense deposit disease. On immunofluorescence microscopy, what are the differences? Type 1, type 2 and type 3. So Mpgn type 1, on immunofluorescence microscopy, what you are going to observe, they are having immunoglobulin IgG, IgM and C3 complement deposits, right? And what kind of deposit you will see? What pattern of immunofluorescence? Granular pattern of immunofluorescence will be seen. So granular immunofluorescence, because of all these deposition, classical and alternative both complement pathways are activated. That is why antibodies are involved. But in case this type 2, there is a only activation of alternative pathway, and that is why you will see only C3 and properdin. So C3 and properdin only will be seen. C3 and properdin, and they will be having dense deposit. There will be no immunoglobulin. So that is the another important thing. C3 and properdin, but there is no immunoglobulin, and they are dense. That is why this dense immune complex, they will be giving a peculiar appearance which is called as band pattern of immunofluorescence. So they will be having band pattern of immunofluorescence. So band pattern of immunofluorescence will be seen in type 3, right? So type 2, and in type 3 you will see immunoglobulin also, complement also, and they will be having granular pattern of immunofluorescence, right? So these are important points about Mpgn type 1, type 2 and type 3. Again, I will recall you. Type 1, you will see granular immunofluorescence. Type 2, dense deposit of C3 and properdin, band pattern, and type 3 will be having granular immunofluorescence, right? Now look at this picture so that we can understand, right? Look at this microscopic view, electron microscopic view of the glomerular capillary. In this, what we are observing, this is the endothelium, and below the endothelium you can see all these are immune complex deposits, the dark color, right? You can see the immune complex deposit is going on, and they are between the basement membrane. You can see basement membrane is here, and in between there is the immune complex deposit. So these are immune complex deposit. So because of this immune complex deposit, we are seeing as if there is a duplication, right? Or as if there is a split, or there are two contour, or there are tram track. Can you see the beautiful tram track appearance, right? So tram track appearance, splitting of the basement membrane, or duplication of the basement membrane, these are all finding of Mpgn, right? And when you are seeing the microscopy, immunofluorescence microscopy, what we are observing here, in this immunofluorescence microscopy, we are observing all these are showing granularity, right? So all these are showing granularity, and this is called granular immunofluorescence of type 1 Mpgn. So this will be seen in type 1 Mpgn. So granular immunofluorescence type 1 Mpgn. When you are seeing this one, you can see in this there are granularity, but you can see there are thick band like, see, these are thick band like immunofluorescence. So these are thick band like immunofluorescence of Mpgn type 2, right? So what you will see inside this band, you will observe C3 and properdin, right? C3 and properdin. So that is why it is called as C3 glomerulopathy. This C3 and properdin are dense deposits. That is why they are also known as dense deposit disease. And when you will see their electron microscopy, now you can see that on electron microscopy you can observe how dense and thick immune complex deposit is present. So this is called dense deposit C3 glomerulopathy or type 2 Mpgn. So these are important point about Mpgn.